Hello. I actually met with Tracy back in March, and we met with the pharmacists over at Duplin, and we kind of all came together. And so what we have been doing with any of the stroke patients that come through over at Duplin is the pharmacists are kind of looking there at Duplin at some of the patients that come in to just kind of see what they may be eligible for medication-wise, so they can kind of get started on the front side. So maybe whenever these patients are discharged, it won't be quite as, as difficult to get them set up with everything they need. And so, so right now they are actually working with me and Tracy as well. But the pharmacist over at Duplin actually kind of, they'll email me if they have anything, if there's patients that are there that they may think, would benefit from any kind of medication assistance, things like that. And so we're hoping to kind of help the patients before they, when they first come into the hospital, to kind of get a head start on everything, so it won't be quite as difficult on the once they're discharged to make sure they have everything they need. And so that's kind of what we're doing now as far as, pharmacy, making sure they have everything. And it's working really good so far.
Thank you very much, Jennifer. Wendy, is anything you would like to add?
No, I would just like to add that we do use this for Compass, but as you know, we also follow all of our high-risk people, and the CCP pharmacists are a great asset for most any patient that we need anything on. They're a great wealth of information and resources, so we're utilizing her and her team for pretty much all of the patients. So I would encourage everyone to tap into that resource for their population.
Tracy, would you like to give just a couple of words about how you've met already with this team early on in their Wave 3 team, and how you have already started the ball rolling with working with this hospital team as well?
Yeah, I'd be glad to. So a little bit about Vidant Duplin, and actually Duplin County is my home as well, so it means a lot to me in this area. And so they are part of Wave 3, and I did attend their initial meeting there as well. And so I think Wave 3 was like the end of November. And so the 1st of January, so I reached out to Jennifer Holmes, who's the stroke coordinator, compass coordinator. And so we just had some meetings to talk through some patients and how they're sort of processing patients, and just thinking through that way with them, and come up with some ideas for some of the first couple of patients that they have had. We had a subsequent meeting that I actually involved the inpatient pharmacy team at Vidant Duplin to help them identify some additional patients. Because of course in the hospitals, the pharmacy team knows which meds are being dispensed and who's getting what, and if they've got to replace them in the ED or in the Pyxis. So we actually met a couple weeks ago and have involved the pharmacy team, starting to also help make referrals to help with identify patients because of the workflow process that's at Duplin. So, just because limited pharmacy resources, and I would encourage you guys to talk with your inpatient pharmacy teams at your hospitals to see how they have a part in this. And so at Duplin, talking with Lee Gurley, who's the pharmacy director there, they are aware of CPESN and others, and so they are part of that, identifying if there's any needs, and are looking at the patient's meds while they're on admission, and thinking about planning for discharge or what they're going to go home on, just to ensure there may not be any issues with their medication. So the inpatient pharmacy team at Duplin has become part of their team as well with that transition.